Good evening, Alabama. Today is April the 26th. It's a Tuesday evening at 7 o'clock, and I want to thank you all for joining us here on the virtual town hall meeting with Yolanda Flowers. Moi. So, thank you so much for joining us this evening. We're going to start off with some questions. Of course, we've had some people to already, goodness, I've already submitted some things. So, I guess we can go ahead and get started with our first one.
Good evening, Miss Flowers. We have a question from Glenda from Lee County. She asks, "Who is Yolanda Flowers, and why should I vote for her? I saw her name on TV when the poll results for the Democrats were displayed."
Wow. Well, hello, Glenda from Lee County. Thank you so much for joining us again. I'm going to say my name, which is Yolanda Flowers. I am from Birmingham. I'm a Birmingham native, and I'm a rehabilitation counselor by profession. I am a mother, a grandmother, a great grandmother, an educator, a community worker. Our dear Alabama, I don't know if you are familiar with or have been quite so tuned, but our dear Alabama has suffered from a malady. And I've been stressing this for a long time, that she has suffered from a malady for so long. And as an educator and a counselor, I know the proper steps to take when someone is ill. There needs to be an agent, I believe, of change, a leader, and an actionable type of person or an actionable plan, and a team to execute that plan. As governor of Alabama, that's exactly how I intend to heal, or as I like to say, and I've been stating, to reconstruct our state. So I'm asking everybody to let's reconstruct Alabama together. Thank you so much, Glenda.
Great, that was a good answer. So, our next question comes from Jennifer from Sumter County. As she asks, "My community is in one of the more rural parts of Alabama. We are consistent having issues with access to the broadband. As governor, what is your plan for broadband expenses?"
Thank you, Jennifer from Sumter. I know the inequity that our friends, and not just Sumter, but in all of our rural parts here in Alabama, um, a governor, I strongly believe, should care for and respond to the needs of all Alabamians. I plan to increase. That's my plan, my proposal. I plan to increase broadband expansion through increased partnerships with the Department of Housing and Urban Development, as well as various companies that could fund internet access across the state. In the digital age that we live in, broadband is a right, and I would see to it that all Alabamians enjoy that right. Also, I want you to think about this. I am pushing also for the lottery. I see that the lottery is used as infrastructure as well. Infrastructure, and I mentioned earlier that I'm an educator. We see that as an education that can also help. And to help clean up our water system, get rid of all these potholes in our city, as well as providing broadband just not only for the rural communities, but also for small businesses. Thank you so much, Jennifer, for your question.
Okay, the next question is from Todd from Madison County. He asks, "As a state with the largest number of HBCUs, how will you actively ensure that the HBCUs in Alabama are funded on par with their counterparts?"
Wow, that's a great question. We have about 14 HBCUs here in our state. So thank you for that. HBCUs are, I consider, the bedrock of so many of our communities throughout our state and throughout our country, as a matter of fact. HBCUs were founded out of a necessity with a tenacity and perseverance at the forefront. Um, I'll make certain that both the federal and state departments of education are sharing those funds equally or equitably, and doing it in a manner, in an equitable manner, all across our state, all across our institutions of higher learning in Alabama. So let's take a step back. I'm going to ask for a moment and look at high school, middle school, elementary school, and preschool. Every level of education needs to be funded properly, and I'm sure you will agree. It's time that we invest in the future of our state, in the future of our children in a major way. I'm a supporter of the lottery, as I mentioned before, and using the institution of a lottery, in which I am a proponent of, when I lived in Tennessee. So I understand how effective the lottery can be for those learning or desiring an education. So the institution of a lottery to fund the services our state provides. HBCUs matter, and we must continue to support and uplift the accomplishments of these prolific spaces.
Great. So, thank you, Mr. Todd, for that question. Our next question comes from Mr. Michael from Jefferson County. Michael asks, I have recently become bankrupt as a result of medical expenses as I was going in and out of the hospital for a rare illness I battle. What will healthcare look like under your administration?
Wow. You know, you're not by yourself. There's so many of us here, including myself, have suffered with the high costs of medical care, of health care. When you have a sick loved one, or even yourself when you're sick, how um, it can really put a damper on things. It can really hinder your way of living. So Alabama, as you know, or may not know, Alabama ranks high for many health issues. Insurance companies discriminate against women, and that's something I did not know until I did some research months back before I started contemplating even of running. But just to know that insurance companies discriminate against women, we know they discriminate against men of color between the ages of 18 and 35 who are not able to get insurance through their place of employment because of its high cost, and the sick. I will be looking for more affordable prescription drugs for seniors, as yourself, and or those who have pre-existing conditions. Medicaid has benefited adults ages 62 and older. But you think about, what about those who are 55 years of age, who are deemed old enough really to be recognized as a senior, as a senior citizen, but because the age limit has been raised to 62, cannot get the benefits they are entitled to. I, as governor, will propose expanding Medicaid to those 340,000 people or plus people working who are poor adults in the state of Alabama, who are uninsured, or even who are struggling to pay for health care. Not to mention those 700 or more people who die each year because they do not have health care coverage. Or even, just get some numbers. Those that are, about 48, 49% of the 12,300 Alabamians, think about that, who died of COVID-19 because they did not have health care coverage. That's a sad thing. Making Medicaid available for those who have underlying conditions or who are 55 years and above is equitable, I believe. I strongly believe that, especially for those who have put in 7 years or more of employment. I am vying for affordable co-pays to primary care physicians and specialists for those who are already insured. Therefore, I'm asking, just if Alabama's legislatures will just consider the plan that I am proposing, that I have written out, that Alabama's new reconstructed health care plan options that will help uninsured people. on those people who are poor, the poor working class citizens and the small businesses to be able to obtain the health care premium. Health care, this health care that all of us deserve. Furthermore, I'm just thinking, furthermore, it will help save lives, create jobs, help protect our hospitals in these rural areas across the state, ensuring that families in rural areas will not have to travel like in Randolph County and having to travel 25 miles or more to be seen by a physician. That's wrong. That's not good. That's not good practices. That's not good love for the state and for the citizens. So these are the things that I am vying for and want to implement for our health care plan. Thank you so much for that question.
Well, it sounds like Miss Flowers, you have a good plan. And you're about to get in there and get to work. Our last question for the evening comes from Miss Deborah from Walker County. Miss Deborah asks, the prison population is quite concerning. What are your thoughts on private prisons in the state and the people that profit from them?
My thoughts on private prisons. Oh, I tell you that prisons in general, the criminal justice here in Alabama, of course, is just off the chain, just terrible. What I found out that a private prison or for a profit, we're going to say profit prison. That's really what private prisons are. It is a place where people are imprisoned by a third party that is contracted by a government agency. That is something pretty much is what our current governor is doing, okay? Private prison companies typically enter into a contractual type of agreement with governments, okay, that commit prisoners, and then they pay a per diem or a monthly rate. It's kind of like they're paying someone, you're paying the leaser or the leasor to house somebody, to house your prisoners. Okay, so you're paying. So you're paying them this monthly rate, either for each prisoner in the facility or for each place available, whether occupied or not. So the real problem with prisons, private prisons, is that they are like a cancer. Okay, private prisons make money by locking people up, and the more people they lock up for, up for more times. Look at this. So the more people they lock up for more time, the more money they make. Okay, private prisons are morally distasteful to me. They don't. I think of this as commodity. It takes me back to slavery time, using the slaves for money, okay, for commodity. You sell them and put them up on the slave block, and they auction them off. And see, that's crazy. Taking me back, oh Lord. They don't save money, okay, and they have historic performance problems, but they persist. They really do. So there's not too much evidence to suggest that private prisons are any better. It's not. Okay, or worse than regular public correctional facilities, which raises questions about what their role really is. Okay, so we see that private prisons tend to take on the different responsibilities, generally working with lower risk offenders. They are expensive to run. We're wasting money. They have no incentive to rehabilitate anyone. They encourage corruption of the court system. They encourage abuse, which we know is happening, and neglect of prisoners because that is cheap and because they operate out of the public eye. They are hard to regulate. That's what we're taxpayers' money here in Alabama is going to do to doing things such as that. Think about that. They're making money.
Well, Ms. Flowers, thank you so very much. So right now we're kind of running out of time, so we're going to ask for any closing remarks.
I just want to thank you all so very much for reaching out with these questions. It lets me know that you really you want to know more about Yolanda, me, the one that is saying that she wants to represent this state and who sees the need of change. I thank you for that. Thank you for wanting to stating your concerns about and wanting things to be better. So I ask that so that you get to know me a little bit more, that you would go to my website, Yolanda for Governor, that's FOR.org. You can learn more about my platform issues. Okay, that's healthcare, education. We touched on that. The criminal justice system, the healthcare. Did I say healthcare? Healthcare. I'm thinking about healthcare, education. Oh my goodness, prison reform. I think I said them all. But please look me up. And I also am on social media, Facebook, Twitter. It's just Yolanda for Governor, all these things. And you get to know a little bit more about me. I'm always posting and just see who you, just know me. See if you like me enough to vote for me, okay? May 24th is what I'm asking for, your vote. So thank you so much, Alabama. I love you guys. I love you.
Thank you so very much
Bye-bye.
for Miss Flowers.
Thank you.